Good day to colleagues who are here in the multipurpose hall and to our colleagues who are online. It is a very motivating to be hosting an other event in this beautiful multipurpose hall. Today we are welcoming Dr. Amina Abubakar. Dr. Amina Abubakar is no stranger in AKU. But we are delighted that she is here today visiting the AKU Pakistan campus because she is from AKU in the East Africa campus. Professor Abu Bakr is the director for the Institute for Human Development of the Aga Khan University. She is a trained developmental psychologist with more than 18 years of research experience. She's very humble, but she has rich experience of working in rural settings in Kenya with multidisciplinary teams. She has co authored more than 180 peer reviewed journal articles and book chapters. She has received awards from various organizations, including the American Psychological Society and the Royal Society of UK, in recognition of her work in Africa. In 2016, she was awarded the Royal Society Pfizer Award in recognition of her pioneering work in psychological research in East Africa and for the impact of that her work has had in the field of neurodevelopmental assessment. She has served on technical working groups, forums, and consulted for various international organizations, including WHO, National Academies of Sciences, Engineering, and Medicine, USA, Save the Children, Autism Speaks, Open Society, and the list goes on. Um, Colleagues, it gives me great pleasure to invite Dr. Amina Abubakar to present from her research, which is entitled Harnessing Data Science for Meaningful Impact on Population Health and Well-being, and the challenges and opportunities in this work. So, Dr. Amina Abubakar. So, Amina, you will speak for about half the time.
Yeah.
Right?
Yes. Thank you, everyone. Great pleasure to be here. My first time to really move around the Karachi campus, and I'm very envious. You have such a beautiful campus. Today, my talk is really about how to use data science to make meaningful impact and some of the lessons we have learned. Uh, I'm also very keen to show the role that goes beyond just statistics. This is one of the questions we were asked. How is this related to Faculty of Arts and Sciences? So, how can we really, it's not just about the maths, it's about how you apply it and make it meaningful. So to guide the discussions, I will have like three basic aspects to it, a bit of background on what's data science, many people, again, the description is around the statistical aspect. Then I'll talk about the work we are doing in East Africa, setting up the Uzima Data Science Hub. And then based on that work, what are the lessons we have learned in terms of the challenges and opportunities when we are using data science to really make an impact on health? Data science has been defined as really an interdisciplinary field of inquiry in which quantitative and analytic approaches are used, processes and systems are developed to extract knowledge and insights around complex data sets. So it's not just about how we analyze the data, but what are the processes? How do we develop systems that allow us to really learn from data sets that we have, most of them quite large, but some of them quite complex? So the process really is what defines data science. So if we are thinking about data science, what are the areas that you'd really pay close attention to? It's about discovering where's the data. And in the modern world, the data can be found in various places, whether it is social media, Right now there's a lot of, wearables people are using. That's where one might find the data they need. But it's also about acquisition. How do we acquire this data ethically, process it, and make it usable for those people who need it? But one of the key issues and challenge in data science is actually when you have developed all these fancy models, how do you distribute it? How do you actually move from development of models to implementation and to making an impact in policy and practice? But also other key areas of importance when thinking about data science is how do we archive this data? It's not about us using it today for Zima and then that is it. Why is that important? Because we can repurpose it. 5 years from today, there may be new knowledge, new things to be discovered, new hypotheses to be tested. How do we set data in a way that is findable, in a way that it's easy to reuse and to manage it? So also, in terms of data science, there are other important things to pay attention to. For instance, development and maintenance of systems that continuously improve the quality of data we have. And this is something I'll talk a little bit more when I look at some of the data sources we are using. So you go and there's a lot of excitement about the data. However, when you look at it, then queries start about the quality of that data. Now, there are two approaches to that. One is to say, oh, this data is not good quality, we can't use it. But the other one is to really query the data and see what can we learn from what we already have so that we can enhance the quality of that data, and we'll talk about that. But also sustainable storages. And again, the issue of sustainable storage comes with issues around ethics, data protection. How do you store in a way that benefits both the participants and those who would like to use that? And then the strategy to promote the use of data. I don't know much about the Pakistan health system, but like in Kenya, we're producing lots and lots of data. The government is even developing electronic data systems, but are they used for decision making? So, a lot of investment in getting this data, but if you ask many clinicians, hardly any use for that data. But it's not just in health, the same in education, yeah? So how do we really work towards ensuring people use this data, but also policies that promote effective and ethical use of data? Because yeah, we have acquired it, we have harmonized, it's available. What are the ethical, social implications? Can big data lead to stigmatization of populations? What do communities think about the use of this data? So just in thinking about a data science hub, it's not just about the data itself, but the whole ecosystem that allows that data to be really useful at a population level. So how can data science be used to harness population health and well-being? I won't spend too much time on this because actually there's an explosion of information right now about it. And but some of the areas in which we see, some of the areas that we just need to be knowledgeable of. I'm so sorry, I don't know what's happening to the slide deck. I'm moving it too fast. Okay, so the next slide, please. So some of the key things is to really note about why we need to think a lot more about data science is the fact that low and middle income countries carry a disproportionate burden of the world disease. Yeah. So there's this huge disease burden. So for instance, if you think of something like HIV, I think it's 90% to 95% a burden of the low and middle income countries. But what makes it even more difficult is that there are actually limited resources for prevention, early identification, and management. And therefore we can't just spend our resources on anything and everything. We got to be strategic. We got to think, where can we make the most impact? If we want to improve maternal, newborn, and child health outcomes, what is the single most important thing? What is the next important thing? So that we really make investment where it matters most. And data science can tell us where can we make the necessary investments? So using data analytic approaches, we can really look at, we can find that the new knowledge we generate through the power of data science can contribute to more precision focused medicine. You can identify what are the risk factors, drivers for specific populations, for specific patients, but it can also enhance early identification and diagnosis. For instance, in mental health now, people are talking about how you could even do voice analytics, how you can look at social media and what people are talking about to identify those who are at highest risk of getting, mental health problems, and how one can then try and intervene early. It can lead to cost-effective drug discovery, but also improvement in patient outcomes and delivery care. So, if we have hospital data and look at patterns of patients who come in, look at recovery patterns, we can actually look at talk to clinicians, nurses on areas that can be enhanced to improve the care. But more important, it can support policymakers. When we are talking without numbers, so not all numbers count, but numbers really help in saying, if you invest this is the kind of change you can make. So this can really support the development of the necessary policies. There's this amazing article that was done about, mental health and what really data can do for mental health. And, those are some of the key areas that were introduced. So AKU is very visionary, or should I say AKU leadership is very visionary. And, while data science is becoming a big thing now, I think there's always been a vision to be a big player in the field of data science. Yeah? So although some of the work we're now talking about is new, it's been ongoing. And there's really like here a lot of fantastic ongoing work around data science. Yesterday, Salim Sayani, the Director for Innovation, was presenting to the Uzima team the work they're doing with an app called Hayat, where the community health workers are using that Hayat, and data, real time is being received, analyzed, and policymakers can actually make a decision based on real time data. So, what was really fantastic is that actually the government is now investing in the process because they are seeing the outcomes. So there's, it's not hypothetical. There's work going on that shows data science can really be used to improve outcomes. So far, and especially in Africa, what has really made data science not have a huge impact has been small piecemeal pilot work, which sometimes doesn't last. You do a small study here, a small study there, you show how you can develop a really good algorithm with a lot of what is this imaging of, let's say, lungs. And then that algorithm can be used to actually, when, instead of having the few radiologists read every scan, that can identify which scans now need to be read by a radiologist, which saves time, increases the speed to which people are attended to. But small pilot studies. Now, NIH recently gave out a huge set of grants to set up data science hubs. And AKU was really lucky to get a hub. It's called Uzima. Uzima is a Swahili word for health and well-being. And we have a website. Please feel free to visit it, to look at the details of it, and to suggest collaborations if you would be interested. So Uzima stands for Utilizing Health Information for Meaningful Impact in East Africa Through Data Science. This is a collaboration that brings South to South partners. So Cambry Wellcome Trust is a research organization in Kenya, but also we have partners in the North, specifically University of Michigan and Dalhousie University. So what does Uzima aim to do? So what Uzima aims to do is to create a scalable and sustainable platform so that we can really use novel approaches and advanced statistical methods, specifically focus on artificial intelligence and machine learning, so that we can develop models that identify early warning signs for poor outcomes. So what are the risk factors? How do we really identify those who are at risk for poor outcomes? And we are focusing on two thematic areas. One is maternal, newborn, and child health, and the other one is mental health. So maternal, newborn, and child health, even with the Millennium Development Goals, a lot of investments that went into it, and now moving on to the SDGs, we still have not reached our target, and there's actually a danger of not reaching them, just the way we didn't reach the Millennium ones. But mental health has remained a very neglected aspect of health in Africa. Many competing communicable diseases, made mental health a much ignored field, but with such a huge population of youth. So Africa is a young continent, such a huge population of youth facing multiple issues, from chronic poverty, unemployment, some of them are born in areas facing conflict. There's a lot of need for issues around mental health. So the three critical gaps we would like to fill with the Uzima Hub, one is harmonization of multimodal data sources. So for instance, and later on I'll show this slide, you find that in our study sites, we have a surveillance system where, for instance, in Cambridge, they have 240,000 homesteads they visit every 3 months and collect data about basic health, migration, in migration and out migration, illnesses, birth, and all that. So we have a population level, very up-to-date data. You also have data on maybe climatic issues, based on location. You can look at issues around temperature changes over the years. And this database has been ongoing for maybe 30 years now. But within the same population, you also have hospital data. For instance, the tertiary hospital has a catchment area of 200,000 people. And then you have clinical trials embedded within them. So this, you find one person and their data is collected across multiple points with different tools. So we would like to harmonize these tools, this data, and really be able to understand, and especially those who have been there, let's say from childhood to adolescence, get a better sense of what were the factors in their childhood that may have negatively impacted outcomes later in adulthood. So that is the second aspect, where now we leverage on temporal aspects of the data, really longitudinal trajectory, to identify early warning signs. And lastly, which is very key, it was actually not a requirement of NIH, but our team said, if we develop all these fancy models and no one uses them, that's a waste of everyone's time. So really, to engage key stakeholders, to engage partners, and we're engaging Ministry of Health partners. So we are able to work with Ministry of Health, but also NGOs and and CBOs. So we are actually looking for partners on the ground within communities who can actually sometimes translate the results quicker than waiting for policy change, and also working very closely with people who have a business mind to it. Now, this is something that took me a little bit of time to fully grasp. We're not trying to sell anything, but what we're trying to say is that, if you have fancy things, nice models, nice solutions that are not funded, they die off. So if you find a way in which you do some social good, but make it sustainable, then that would work better. So we are looking at, how do you come up with a business proposal when you come up with very nice models about how to impact health. So those are the three critical gaps we hope to be able to achieve. So Uzima has 5 cores within it. It's a hub. So we have the admin core. It's the boring part, I always say, the one you chase people around, but very important because you need people to actually get things done. And you need to sign agreements, data sharing, collaborations, to arrange meetings where everyone turns up. So those are what the admin core does. Then we have the data management and analysis core. What this core does is really the one that is working towards developing the data infrastructure that we hope will not just serve Uzima, but will really serve anyone within the AKU who would like to use it. So they're looking at what is the best cloud system we can use. They're thinking on how can we train people, because part of infrastructure is training people to be able to do the work. And then we have the dissemination sustainability component. This is the component that really focuses around how do we take the information out to the community for people to be able to implement. Then other than the cores that focus on the more administrative coordination aspects, we have the two research cores, which is maternal, newborn, and child health, and the mental health project. So I'll try to go through each of these core very quickly. I think the admin core we passed, so we can just look at the mental health core. So the mental health core has three sub projects within it. The first one is we are really trying to look at mental health among healthcare workers and look at how can we identify it using mobile signatures and self-report measures. So what we are doing is we are now piloting it. So the hub is maybe less than a year now, maybe 11 months. So we are still at the setting up. So we are piloting the process where we get healthcare workers, especially those who have newly joined as doctors or clinicians, to wear Fitbits, and based on this, we can collect data on, passive aspects of their functioning, but also they can send us data where they self-report on mode. And this then can be analyzed to see as they progress in there. So I think initially it was to be a one-year program, but based on lessons from other countries, because a similar project is being done in 30 other countries. We're now looking at first doing 6 months, just to see how things change as they stay into their career, but also to develop models around how to predict depression and suicide among adolescents and young adults. And this will be using longitudinal surveillance data. So we have data for children who have been seen since they were around maybe 5 to 6. So now they're getting into their adolescence and young adulthood. And lastly is to look at data, setting up a very robust longitudinal mental health database in Kenyan University. I think we're going to work with students from around 4 or 5 universities. So that's what the mental health core will focus on. The maternal, newborn, and child health core will really focus on looking at what are the predictors of risk factors for poor pregnancy. So poor pregnancy, we are looking at things like low birth weight, stillborn, Then we'll also be looking at what are the predictors of poor outcomes for children between 10 to 15, for children who again are young adults. But what we are going to focus on is really neurocognitive outcomes, educational outcomes, transition into the health force. And lastly, we are going to look at what are the predictors of poor outcomes based on what are these pregnancy indicators. So let me give an example of this. So rarely when a mother has, let's say, hypertension, pregnancy-induced hypertension or pregnancy-induced diabetes or has stillbirth, they're rarely followed up later in life to see what has happened to her health as an outcome of this. I know there is data coming out of high-income countries that does indicate negative outcome in the long term. But our support system, whether formal or informal, the health systems differ a lot. We cannot assume that that data will translate exactly to the same thing in our context. So we want to follow mothers whom we have their data from around 15 years ago when they were pregnant, to look at what has happened to them in terms of health and well-being, and what are the factors that predict those who will quickly end up with NCDs and other forms of complications. So the last core, of course, is the bridging the gap between prediction model, adoption, and dissemination through working systematically with a community strategy. And one of the key ones we have started is right before starting Uzima, we have done consultations. So we have had a series of consultative workshops. Each workshop takes at least 2 days that has involved different stakeholders in the community, including what are they called? The community health workers, clinicians, health directors, but also mothers, adolescents, university students, so that they can tell us, are we focusing on the things that matter to them? Are there areas they would like us to change? For instance, in our project, we've largely focused on mental health, common mental health disorders, depression, and anxiety. But in one of the communities we went into, they're very interested in psychosis. They want a better understanding of psychosis, and that we have put into our agenda, because we must answer the questions the communities are interested in for it to have impact. Then the data management and analysis, they are working really hard to acquire the data, and then of course to train people to do artificial intelligence and machine learning, be able to evaluate and interpret these models, and then lead it to decision making. So one of the very unique and interesting bit we are planning to do is that when we develop these models, we'll have rapid cycle evaluations. So we'll take them out to the community to evaluate, is our interpretation of the data correct? Is there something we are missing? So that is the point where we don't just do statistical evaluation, but get the community to tell us this works for us before we disseminate it. So what have we learned? The first one is that we were very naive. When my boss rarely asks me to do anything, he gives me a lot of leeway to decide how the institute shapes. But with this one, he said, I think, Amina, you can take this challenge. So I was very excited. I thought, wow, this is nice. So I've learned within the last few months, it's very nice, but it's a challenge. But I don't look at things as only challenging. I look at them as also opportunities. So what have been the challenges and where are the opportunities as the hub grows and develops? So the first one is that we really have motivated, ready to learn youth. And in Africa, there's a proverb that says, if the king has wise people around them, they will look intelligent. So, we need to bring all these very technologically savvy, young people around us, then they can make the rest of us look we are intelligent. So we have this potential. Like in Kenya, it's always amazing. You go for interviews and you think, whom should I take and whom should I leave? We have so much potential, and this is really across all low and middle income countries. Yeah, we have young people, and to really harness the power of data science, we need to bring them into the fold. We need to work with the youth who know how to work with technology, who can quickly learn and translate the information we have. So I think the key opportunity for me as I think of this hub is, how are we going to build capacity for young people within our setting to be the one who lead this work? It has to be led by us for it to really mean something to us. I think that's something most of us are clear on, but I usually like to bring it right in the fore, that we need to bring up the youth to really own this data and make it meaningful to them. So she's just joining as a PhD student. She has a bachelor's in mathematics, a master's in applied mathematics, and a master's in machine learning. So what we need to teach her most is, how does she disseminate all these models. Yeah. So some will come to learn data science as statistical. She comes to learn the translational aspects of data science. So recently there has been a proposal on if we are thinking of developing data science models. This was specific to Africa, but I think it would be really same for everyone, every other place, is how should we think of it? Again, a very multidisciplinary approach to the core aspects. What I really like about this model is the fact that we are putting social sciences, we are putting ethics right at the middle of data science. Yeah, we really do not want it to look like we are mining data. We want this data to feel as part of what the community is offering that will help the global community to learn, but also will also help them to learn a lot. So there is a really urgent need to develop courses that address data science issues, and these courses have to be multidisciplinary if we want them to make impact within our settings. The other one, don't bother to try and read, it's very small, is we also have a lot of data. Actually, when we started this process of thinking about the data science hub, I remember some of my colleagues saying, but really, can we be successful? We don't have big data. But when we started looking around, there's actually data out there. It is just not, so like for instance, some of the data hubs, data sources we are looking at, it's 240 households over 30 years. You know, we are looking at the AKDN hospitals, which have so many pregnancies and births on a yearly basis. We are looking at cohort studies that have been ongoing for some time. So data is really a huge opportunity. Now we have multimodal data sets, but also we have an opportunity to collect more data. Actually, today I was meeting, the head of the Women and Child Health, and he told me, one of the beauty about Pakistan, you can get 100,000 people very quickly. It's not, the population is huge, it's dense. You can quickly deploy and get the data, which in certain parts of the world that would not be the same. But also with technology, we can do a lot more technology-driven data collection, which is less intense. However, the other opportunity is we can build partnership as part of data acquisition. But you see, these partnerships have to be equitable, they have to be meaningful for everyone to jump onto them, but we really can build. I'll talk a little bit more about the partnerships that I think can make this opportunity really much greater. Now, what is the challenge with data? One is quality. So there's always that excitement, and then you start looking at it, there's a lot of missingness, like especially hospital data. The doctors have a lot to attend to, the nurses have a lot to attend to. So as I said, we can say, okay, this is not something we want to continue with, or you can say, let's look at the data we have, look at what causes the pattern of missingness, and then how can we improve the quality? But more important, to actually motivate clinicians to want to continue doing it, you have to show them how is it useful for their practice and for their work. It's good for everyone to be altruistic and look at the larger good, but it never harms if you also tell them how it benefits them, it encourages them. The other one is like, I'm not so sure about the situation in Pakistan, but in Kenya, quite an amount of the data is in paper format. I know that right now there is a push towards developing models again that can read paper format data, but that is really a huge challenge. So you go to government and they say, yeah, we have lots of data. Okay, I have one PhD student who had to go into this whole store and kept, looking for one file after the other. And some of those files are 10, 20 years old. You pick them out, they're just yellow, you can hardly read that. So that's a challenge, but again, an opportunity to think of how do we digitalize the systems so that this data can be easily used and accessed. But also, the other challenge is that now there are evolving data protection laws. So like in Kenya, 2019, a data protection law was put in place. Right after we submitted Uzima, a data protection commissioner was appointed, and they're now becoming really strict about how you are using data from the Kenyan population. So we need to do the most of it, and it's a good thing. Without the right protection, data will be moving all over the place, and soon we'll not have any privacy. Yeah? But that is one challenge we need to understand, because we need to actually look at what are the legal frameworks that allow us to share and use this data in a way that we do not. So recently, I think last month, a university in Kenya was fined $7,000 for using a student's photo without the student's permission. So that's the level of protection they are now getting to in terms of personal data. But even when you look beyond we are now talking about the government, the community, but there's that trust between scientists. 2 more minutes. Oh my goodness. Okay, I need to. There's that trust between scientists. People want to give you data, but also it's a lot of effort to get this data. How do we share? And how do I ensure that I retain ownership, that the benefits is equitable? Those are some of the challenges we've been grappling with. But the public perception. So communities are not yet so aware of data, but when you talk to them about their personal data and its usage, they can become very untrusting. So there's still a need to educate the public, but also dissemination from academic to non-academic partners. It's not been so good. I think that one I've talked about. So where are the opportunities? I'll go very quickly. A multidisciplinary hub. We need to bring in subject matter experts and data scientists, but we need policy experts. I ended up just saying social scientists because there are so many different groups, but bioethics and legal experts and communication experts. So when you come up with a multidisciplinary hub, it really allows a holistic thinking about the way you want to set up your data science hub. But partnership between North and South, but partnerships with communities and with governments, and always equitable partnerships. So in thinking about data science, we need to think of what does it give my partner by being part of this movement? How do I ensure communities benefit? If they have no benefits at all, whether short-term or long-term, participation becomes very difficult. So in summary and conclusion, so we in the low and middle income countries carry quite a large disease burden with limited resources. And I think if we use data science across its full spectrum, so I'm really focusing on the full spectrum, not just developing some fancy models, but developing them, disseminating them, getting people to use them, I think we can address some of the major health gaps we have. And we really hope we need very well thought out interventions to fully realize the potential of data science. So small piecemeal work will largely produce one or two good papers, but we need interventions that say, what are the kind of challenges we are facing and how do we holistically address that? And I think the Uzima, I hope, the Uzima Data Science Hub at AKU can really grow to become a model of such a hub that is multidisciplinary, engaged in the full spectrum of data science, and makes impact in the areas it's working in. Thank you.
Thank you, Amina. That was really a wonderful presentation, providing us with a lot of food for thought. Now we have time to take some questions, and I have one, two, three in the hall, and then from the hall I will go to the online. So Munira, you will keep track of questions coming online. Is that right? So no, Abdul Khalid, sorry, is there a mic here, or should Dr. Amina speak from here?
Thank you.
All right. So we will go to Dr. Saiba there, and then Dr. Stephen, and then Kareem, right? Okay. So to you, I will come after the online, if subject to time.
Thank you, Amina, for a brilliant and very comprehensive talk on on a very, very interesting and a new subject. So my question is that you mentioned many times during your talk the ethical issues and the social issues and the community partnerships and the fact the challenges in trying to to address the community and the difficulties because of lack of awareness of the community. So in research, there are a lot of clinical research, population based research. There are a lot of examples where very huge studies had to be stopped because the public, when certain results were starting to be revealed or certain tests were being done, the public made an outcry. And so this happened in Thailand, this happened in Africa, in India, where these studies had to be closed down. So are there any such examples in data science management and data science results and their conduct where similar kind of reactions have been met by the community, or is it too early to say such things?
Uh, Thank you. I actually don't know of a specific example. So my thought would be, especially in the African context, it is too early to say that. But I think NIH has learned from other programs, and that is why, as part of the data science team, they have a whole stream on ethical, legal, and social implications. So really trying to be very careful, even at the very start, to have bioethicists advising. Yeah.
Thank you very much. I think that was fascinating, and I think it belongs firmly in the Faculty of Arts and Sciences. So this seems to me to be something that is connected to our colleagues in London, the digital humanities, using machine learning to better understand large corpus of text. I have a specific question for you, which is you talked about using Fitbits and these mobile devices to capture information. I mean, I think this is a brilliant idea. I think it's fantastic. I've seen some studies where that does it. The anxiety that I have about that is that it in fact individualizes medical situations and it personalizes, so that depression and anxiety and suicide is the individual, it's the physiological organism. And I wonder, and I'd like your view on this, does this take our eye off the kind of structural, cultural, political, economic factors, and do we place it all in the individual and in maybe inadvertently make it even worse, which I think has happened in North America, where we put all of that on the individual and say that's your fault, you are defective somehow, put the Fitbit on, we'll find the defect, we'll fix it, rather than saying actually you are a single mother with 5 children and no money, of course you're depressed, that's not your fault, you're supposed to be depressed. I'm just wondering what your views would be.
Oh, thank you. So one of the key things I think we are very keen is to look at the social determinants. So even while we are collecting data with Fitbits, we are also collecting a lot of social information. So we are looking at issues around, of course, age, marital status, social support systems, income, so there's quite a lot of other data that will come along with it. So I think in modeling, to look at the prediction models, we will go beyond just clinical indicators or any one single indicator and really try to model. And this is across not just the Fitbit study, but all our study. We are looking at clinical, biological, social, environmental factors. Yeah. And because we fully agree with you, it's really an interaction of various factors. And as you say, in looking for where to intervene most efficiently, you might find it in the most interesting corner. The least expected corner might be the one that has the greatest push. So we won't focus on only clinical indicators. Yeah.
Let Dr. Hoodboy ask first, because your hand up went up before mine. That's okay. Go ahead. I'll ask.
Amina, I have comments. When you were speaking, I felt like my soul was right there. Your work resonated so much with what I do and what a lot of my collaborators do in terms of the maternal newborn health, doing pregnancy risk stratification. We also have surveillance sites in Karachi. The challenges you spoke about, which we face as well, is where do we find the right kind of people? We still have the as more faculty of health sciences, we have the kind of capacity to make sure data quality in terms of health variables is up to the mark. But who would look at that with the more engineering perspective, right? Because without that, we are incomplete, especially when it comes to data science. And that's why we also approached you, and we're trying to develop this masters of science in health data analytics in the next couple of years, inshallah. And the idea is that then, the two streams work together to kind of really harness what the potential is. My thought is, you spoke about north south and south south partnerships, and I'm just wondering, we stand at the same institution, we are like siblings, the two campuses, and how do we then collaborate? Because there was just so much similarity in what you spoke about and what my daily life at AKU here is. And I think it's really is an opportunity we need to cash and do a lot more, because our problems are similar. We have high disease burden. Mental health, I won't comment on because that's not my area, but I understand that that is a problem for us as well. But our indicators are equally bad as yours when it comes to maternal and newborn health. So I think really an opportunity for us to collaborate.
Thank you. I would love that. It's really part of my visit here to be able to meet people and think about ways we can work closely together. And when we develop some things, how we can use across sites and synergize. So looking forward to that.
I mean, once again, great presentation, and I just love listening to you because you can take a very complex area and bring it much closer to layman like me. So thank you for that. But I was just wondering to what degree of it, how much do you integrate with other AKDN organizations when you're looking at access to data? Are you integrating with AKHS institutions because there's so much opportunity out there, or is it strictly right now just an AKU endeavor through Azima?
Thank you. So we are actually collaborating with Aga Khan hospitals. We are just in the process of finalizing an MOU for data transfer and discussing ways in which not only do they transfer data, but actually become part of our process of analyzing, understanding the data, and informing them how they can use that data to improve practice. They're very excited because they've been collecting this pregnancy data for a long time. They worked with Salim Sayani, set up an nice app, and they've been collecting data across also Asia. So, initially with Uzima, we are focusing on East Africa, but that means that after we've developed that, we can try for the data in Pakistan and Afghanistan. And really what the Aga Khan hospitals would like is how to use data to improve their practices. So we are in that discussion. It's the beauty of being within the AKDN network. You can really work with the different arms. Thank you.
Munira, do you have a question? Okay, so just one other point, Kareem. One of the purposes why Dr. Amina Abubakar is here is also to establish her Pakistan office. And so very soon you would see the presence here on the 14th floor, inshallah. Yes, so Munira, do we have questions online? Okay,
Shall I
so
read it? It's from Dr. Zulfikar Bhuta.
yes.
He's asking, could you say something about one aspect of data science which is also proving vexing? The open data access concept in health research. How do we achieve this?
Yes.
One
So,
aspect of data science which is also proving vexing.
Thank you, Professor Buta. So in terms of open data, I think my opinion, first, there are two things. One of the key challenge, at least in my discussion with some of the people from the low and middle income countries, is that when you collect data and put all of it open and you don't have capacity to analyze it quickly and use it, then those who didn't participate may move in quickly and use. So I know there's mistrust there. And the other option, of course, is the issue of how do we harmonize? It takes a lot of time if you're looking at big data to harmonize and put it up there. So I think the solution to this, again, goes down to us building capacity around, young people here to, within our settings, to analyze this data and maximize it as much as possible in a short while before it can be put out for everyone else, but also developing our own infrastructure so that we host these open data sets. Thank you.
Another question? Yes. So maybe you can read it together.
So we have a question from Nora, and she's asking, how does AKU plan to handle consent by using available data from patients? And second, it's a statement from Dr. Samin. He's saying, apologies, missed most of the session. What are your thoughts on this statement? The data sciences degree programs is an odd one. It can be what you want it to be. It is run by different departments depending on the university and their experiences. Sometimes the IT departments, other times the statistics departments, or even a business management department. So it's a thought on the statement.
Okay, so my point on the statement would be that we as AKU really have an opportunity to develop a course that serves our needs. So because the data science is very generic, it's a methodology that can be used across different what is it called, disciplines. So I think what we would need to do is to sit down and say, what do we really want our graduates to have? My preference would be a very multidisciplinary degree that allows us to look at the different spectrum and really also focus on how it's applied in the fields of health, but also education, because it also has a lot of application there. Sorry, I forgot the other one.
How does Aga Khan University plan to handle consent by using available data from patients?
How do we plan to handle consent? So two things. Yeah, those are some of the questions that are a bit difficult, but I think we will use what has been the precedence. The first one is that any data has to be fully de-identified. Yeah. Now, historical data, there wasn't any consent for potential use. So what we would do, like the current one, we have gone to the ethics committee to ask for waiver to use completely de-identified data for this purpose. Yeah. Now, I can't really speak on behalf of Aga Khan. There's actually a data science governance committee, I think, and this can be discussed further. So this is fully my opinion. So there's really the option of now talking to patients about, do you allow, because I know we are now doing that with research participants, asking them beforehand, there's a possibility that this data can be reused, it will be put open access, these are the benefits of it, you give us consent. But this is not, I don't know anywhere it's been discussed, it's just my suggestion. Thank you.
Sorry, go ahead. So you can take the mic so that others online can also.
Thank you, Dr. Amina, for a wonderful talk. Just continuing on the last question, and I'm from Department of Anesthesiology, very clinical, and then I'm also doing masters in health profession education, so I'm involved in education. But now, just thinking about what you have said, that you need multidisciplinary people to collaborate and do research. So my question is very basic, like what background knowledge we have about research is very basic. Like we have done some retrospective studies. So the first issue is we did not have electronic data system. So we used to do manual searching from files, like you said, 20 years back, yellow files, and we can go retrospectively and can apply data science for projection in future or something like that. Because the problem is many research questions which come to my mind are present in the previous files. Are you getting my point? Because
Yeah.
we don't have electronic system as such. So we need to, hand search previous files, old files, and then come up with some research question. But then how come this newer things like data science or AI comes into this place and how do we fit here? So that's
So
it's a very,
I see you're smiling. You want to help me with that one?
There are challenges. There is no doubt about it. It wasn't collected with the objective you have in mind that you want to look at right now. But it still has a lot of value. We have data over 20, 30 years, and I know with Dr. Samad's team, they've done a lot of analysis on the NCD work and looked at how women, especially, are affected with cardiovascular disease. It is a challenge, and there are ways to, like, for instance, lab data is still in more a digital format, or pharmacy data is still digitized. So those are easier. When you go to handwritten notes, it's a challenge. But with the EMR coming soon, I think we will be able to get a lot more done much faster. And so this is just the right time that we're talking about it. Once we have the EMR and we have this capacity in house, then we can do a lot more. With the retrospective, it's a challenge, but still worth it.
Okay. So, Dr. Amina, it's clearly an area where there's a lot of room for discussion, even within AKU. So we are over
Can I just make
time.
a
So
brief
I'll just
comment?
take one comment from you,
Yeah.
and then I'll request. Okay, so
So
one
just a
quick
brief
comment from
comment
you.
in response to the last question.
Mhm.
So I'm a clinician, and all of us who are clinicians here know that when a patient enters AKU, they have to sign a consent form, say which allows which allows that property, all the data that is collected for the patient, that is the property of AKUH, and that can be used for research. So the consent is already there.
Okay, I think that is for here. Oh, that's good to know.
Okay.
For Pakistan.
So Amina, you were asking if there's a forum where ethical issues are discussed. So the University Research Council has a very robust system of ethics review committees, and that's also a platform where all these issues are discussed and policies are continuously being reviewed and updated. And I think you are now a member of the EURC. But we need to bring this very interesting session to a close. So Munira, if you could request the colleagues online to email their questions to Dr. Amina Abubakar directly, because we do need to bring this session to a close by thanking Amina Abubakar for a very interesting presentation that obviously has generated a dialogue which needs to continue within AKU and also broadly. So with that, we also have a tradition at AKU to honor. Can you bring me that mic? I will invite the Dean of FAS, Professor Steve Leons, who has actually declared ownership of the work that you are doing, to present to Dr. Amina a token from the FAS.
Thank you. I should visit more. I've gotten so many presents today. Thank you so much.
Okay. All right. Thank you. Thank you, Steve. And thank you, colleagues, for joining in. Thank you.